think we've got a great program for you. And I see some numbers are still climbing down at the bottom of the page there. So you might hold off just another minute or two and see. Chase, we have them all? You can nod your head. We're good to go. All right. Again, thank you very much for joining us. I think we've got a great program for you today. We appreciate all the feedback we're getting from you between programs, because we're getting a lot of questions. And oh my gosh, we could spend half the day doing this. So we're going to pack a lot into the next hour and a half. Jim, let's go to the next slide and we'll keep moving right along here. We really focused on two main things this week. We want to take care of the help with the healthcare issue, because as you start to open up and you've got to do some analysis on your employees and stuff, we wanted you to hear from one of the real experts in our community. So we're going to start off with Dr. Kraig Humbaugh, and then we've got our whole team of folks that are going to cover a variety of issues. And then you can't imagine the stack of questions we've gotten this week. And there's a lot of things that still need to be straightened out with the state, but we're going to share all that with you. And I think you're going to really enjoy it. We'll have plenty of time for questions towards the end. Let me start out by introducing Dr. Kraig Humbaugh. We are so fortunate in Fayette County to have such an outstanding expert. He's an MD and has an MPH. He serves as our Commissioner of Health for the Lexington-Fayette County Health Department. And he's been doing this since 2016. But prior to that, he was 12 years with the state as the director of the Division of Epidemiology and Health Planning. So he's well suited for this job. And I bet he wishes nothing like this ever came up, but it has. But a little more about his background, just because it's so darn impressive. He's practiced medicine for many years. He's a board certified pediatrician. But he also earned his undergraduate degree from Vanderbilt University. He studied a Fulbright scholar at the University of Otago in New Zealand. And he received his medical degree from Yale University, and he has a master's degree in public health from Johns Hopkins University. So he certainly has the degrees to make him an awesome leader in our community for this. And Dr. Humbaugh, we're just honored that you're here today. He's going to share with us some of the things that are going on with the health department and how we can recognize the challenges that we're facing. And look right under his name, notice that, let's put his photo up there, Jim. Oh, you got it, yeah. Notice that there's a COVID-19 hotline that the health department has right there, 859-899-2222. You might want to make a note of that, because if you have questions about how you're doing things in your shop, or who you communicate with, if you think somebody really has a problem, that's the number to call. All right, let's move forward. Dr. Humbaugh, thank you for joining us.
Great, Lyle. Thank you for the opportunity to be with you all today. Gosh, things have been going full tilt here for the last 3 months. I know you all have been in this strange time as well. And I was asked a little bit to talk to you about some of the things that we're doing here at the health department, but really to emphasize some of the relaxation of the rules and what that means for businesses. And so I'll spend a few minutes going over that, and I have some slides. I'm assuming that you guys will advance the slides. Is that right, Lyle?
We will. And you know what? Your camera was working great earlier, but it just has a fuzzy white now.
Uh-oh. Okay.
Is that off the back of your computer?
Yeah, that may be it.
How's there that? You go.
There
like
we go.
That green
all right.
sweater.
Thank you. Yeah, I can't see myself on here. So thanks. Is this okay?
Perfect.
Okay,
Great.
Good deal.
The patient is looking good.
So let me just start out so that we're all on the same page, but a pandemic is just a fancy word for saying that this is a global epidemic. And in a pandemic, the problem is that no one is immune to whatever the germ is that's out there that's circulating. And in this case, it's the virus that causes COVID-19. And that's our problem. And we'll talk a little bit more about that. But because we've been doing such a good job slowing down the virus here in Kentucky, we feel that there's really very small percentage of people who are actually immune now from natural immunity to having had the disease. So most of us are still very much susceptible to getting COVID-19. We think COVID-19 spreads in much the same way as other respiratory viruses. You've heard this expression before, but we're all trying to, build the plane as we fly it. So we do think, again, based on current data, the data are not showing anything different, that it's very much like influenza in the sense that people who are sick, when they sneeze, when they cough, when they just are talking, they're expelling small droplets that are microscopic that contain these virus particles. And then those of us who are susceptible, which is, like I said, the majority of the population, when we breathe in those virus particles, we can get sick that way. The other main way that we need to understand that people get sick is probably a secondary way of transmission, is just like the flu, when somebody is expelling viral particles and it lands on an inanimate surface, and then we as susceptible people come by and touch that surface, then we put our hands that are unwashed in our mouth, in our eyes, in our nose. That's how we can infect ourselves or inoculate ourselves as well. And that's a secondary way, and that's why hand washing is so important. So unfortunately, no current vaccine is available. That would be another way for us to produce immunity in the population, and hopefully in the future, that's going to be the main way that we can produce in the future. If you just go back to that first slide again, I think what people need to understand is, in order to reduce the spread then, given how the virus spreads, you need to wash your hands frequently and often, and that's just with regular soap and water. We need to avoid close physical contact if we can, and we'll talk more about that in the business setting. Cover the mouth and nose when you're and face when you're around others. You can use either a regular surgical mask or a cloth mask. We can talk about the advantages and disadvantages of that if you're not able to physically space. And then, although my thought is that is not a substitute for physical spacing, so physical spacing is the best way to go about it. And then cover your cough when you sneeze, and clean and disinfect surfaces with regular household products. So go on to the next slide if you would. And I think that's signs and symptoms of COVID-19. If we could just understand that a little bit better. So many of the signs and symptoms of this illness start just like any other respiratory illness, and they can occur 2 to 14 days after you've been exposed or the virus has entered your body. And that's what's called the incubation period. And the average incubation period for this particular disease is 5 to 7 days, we believe, at least based on the data that we have now. So some of the things that start out first are cough and some chills and some difficulty breathing and muscle pain. And then fevers is a very common symptom, but may not be present right at the beginning. Scratchy throat is present in some people. It's interesting because this symptom of a new loss of taste or smell has gotten a lot of press, and it is certainly something that we've had reported from our own cases here in Fayette County. And so that's something to be aware of. And then there are less common symptoms like rashes or rashes on the toes. And you've probably read about these in the media. These are less common, but do occur with this particular virus. So next slide, please. So let's talk about this new normal that the governor has talked about in terms of workplaces. And I think the key here is going to be that in order for businesses to be successful and to reopen, I'm not sure whether I like the word reopen, but as we relax some of the public health mitigation restrictions that we've had in place that have been so successful in slowing down the virus, then the public and your staff are going to have confidence that risks are being reduced, and that they're at minimal risk of exposure. And that's what all the governor's rules about this new normal are, and we're going to talk about those. So these minimum guidelines have been set, and there's a couple places that you can find them if you're not already aware. You can look at our website, which is lfchd.org. You can also call the information line that Lyle talked about, which is 899-2222. Or you can search for Healthy at Work minimum requirements. If you do a Google search for that, you'll get that website. It's very informative. It's updated regularly, sometimes a couple times a day. So you could consider actually going to that site, putting it on your favorites, and looking at it for updates and for industry-specific guidelines for your specific industry that you work in. So there's some general guidelines I'm going to go over today. It's called 14, I think it is, rules or requirements that have to be met for the new normal. But there are also, as you'll see, like specific guidance for funeral homes when they open up, specific guidance for retailers, specific guidance for other industries. But all these things I'm talking about today are in the 14 points that the governor has put out in terms of every business, including the health department. We've got our masks here today that we are all having to abide by in order for us to be able to work in our workplaces. So first of all, number one is, if you've had people that are able to safely and effectively telecommute from home, then please continue to do that. Try to be flexible and creative in terms of what they can do and if they can work from home. This pandemic has transformed the way we do business here at the health department. We're never going to go back to we were talking last week, we'll never be going back, in fact, exactly to do things the way we did before. We're always going to be probably having some people telework from home because we figured out that they can do that, and they can do that very effectively and efficiently. So it's interesting. So sometimes bad things can have results that we didn't expect that actually may help us increase our efficiency and do a better job of being an employer as we move forward. And then make use of, in order to do that, current technology, and you may, as an employer, have to provide that technology so that your staff are able to telecommute. Number two is a phased return to work. And by that, it means just not turning on the on button immediately, but actually gradually lifting restrictions at your workplace. And you may want to consider that. You also want to consider to ensure that sick employees can stay home. So have the HR policies in place, if you don't already, that employees are able to take off work and can stay at home when sick, because you really want them to be able to do that. Enforce social distancing. We talked a lot about that. I like to use the term physical distancing, because I think that it's more, I think it's a better term in this year of 2020, that we can physically be apart and separate, and yet we can, through our electronic devices, be socially connected. And that's what we want to try to do in a workplace setting. We want to be physically apart, but we want to be able to carry on our business just like we normally do, if we can. Keep staff and customers who are on site physically separated from each other as much as possible. And you guys know how to do that. We'll talk more about that. Limit face-to-face interaction. I would suggest that you do a walkthrough of your physical facility and you identify common areas or narrow hallways and stairs, and other places where either the staff or the clients could potentially be congested or congregate, and then try to change the workflow so you can eliminate that. And that may mean eliminating specific, the ways that you do things or the travel that people have up and down the corridors at your office, and as we'll talk about in the future, changing your break room around, eliminating chairs from your break room. Consider potentially staggering shifts, or extending your shifts so that you have maybe the same amount of work gets done, but it gets done by fewer people over a longer period of time, or you're staggering so that not everybody is working at the same time. That eliminates people being physically there and coming into contact with each other. Next slide, please. One of the questions that we get a lot is about conducting staff temperature and health checks daily. And so I put this all on one slide. It's actually one of the 14 points that the governor has had. So first of all, I think the main point I'd like to say is have staff take their temperatures at home and monitor themselves for both fever and symptoms, and tell them don't bother to come into work first at the beginning of their shift if they're symptomatic or they have a fever. And then if they come in and they do have a fever or symptoms, then you need to be able to empower your employees to tell them, go home and stay home. If they need to get tested, you can figure that out. We'll talk about that, but don't allow them to work. So there's a couple of different ways that you can do the daily temperature and health screenings as an employer. You can either do on-site temperature checks by taking them yourself. So you assign an employee and then they inquire about symptoms. And then they do maybe an infrared screen of their temperature every day, or you can actually have the employees self-administer temperature like we talked about and do a health assessment. And you can do all of that and have the employees do that, and then they report that when they come to work. So the types of things that should be on that self-assessment or the assessment that you do as your staff person are listed here: fever, new cough, shortness of breath, all the symptoms of COVID-19. And if they have any of those things, then you want to turn people away. So you can do it in two different ways. You can either do it yourself with an employee who's assigned to take temperatures and monitor symptoms, or the employees can actually do their assessments themselves before they come to work and report that. Next slide, please. So universal masks, we all have masks now at the health department, and you should be able to have those too. You should, as the employer, provide those masks. You can either have cloth masks, this is a cloth mask, or you can have surgical masks. Surgical masks actually are more effective than the cloth masks. What the masks do is they actually contain, when you've got them on, they contain the germs. So if I'm symptomatic, for instance, or I'm asymptomatic and I don't realize that I'm spreading or shedding virus, this mask will trap my germs in here. And so other people who are around me are less likely to get sick from my illness, even though I may be unsuspecting and may not realize that I'm shedding virus. They aren't as helpful for people who are wearing them who are trying to protect themselves from getting the virus. They're more protective from what we call source control. So they're better used for people who are sick and preventing others from getting sick. We should encourage everyone to wear a mask in the workplace. All the employees, that should be enforced, but encourage clients to wear a mask. Adequate hand sanitizer and hand washing should be available. Make sure the employees have plenty of time to be able to wash their hands and use hand sanitizer. Restrict common areas. Maximize the physical distance in your break rooms. Limit the number of seatings in the common areas or in a showroom or wherever let's say a lobby that your clients come into. Proper sanitation is another point from the governor's list. And this doesn't need to be fancy products. These are normal household products, but focus on frequent cleaning, high-touch areas such as doorknobs or computer keyboards, any place that people are touching regularly. Frequent cleaning of those is important. Next slide, please. Finally, this is the last slide. Create a testing plan. Determine how an employee with COVID-19 symptoms could be isolated immediately if they become sick at work, and how they can get tested. Make special accommodations, and by this, the governor means to the extent possible, put those who are at highest risk for severe complications of COVID-19, like the elderly or those with chronic disease, in positions that are less likely to be exposed to the public or to be exposed to other coworkers. And that means that they're more likely to be protected, and because they are at highest risk of getting the sickest with this particular illness. Designate a healthy at work officer. That's pretty self-explanatory, but someone to be your key point person. Educate and train employees. I know here at the health department, we're having weekly video teleconferences or teleconferences with the staff to explain our new procedures. We're trying to explain new HR rules and trying to make sure that we answer questions so that everybody's on the same page as we go along. And then finally, contact notification responsibilities. This is really about your interaction with us as your local health department. So be willing to work with public health authorities if an employee tests positive or is a close contact or someone with COVID-19, someone with COVID-19. You might consider block scheduling. What I mean by that is you the same group of employees on, and then you alternate with another block of employees. And that way, if somebody gets sick, they're only exposed to that same block of employees that they always work with. That limits the exposures in the workplace. It also makes contact tracing easier. What can also help us with contact tracing when we're schedules handy, you know who worked when, and you have contact information for all of your staff. So I know that's a lot. I wanted to make sure I covered all the 14 points that the governor had in and say a little bit about each one. Are there questions, Lyle, from the audience today about any of the things that I've talked about? I know that is kind of a quick 101 on what business should be planning for and thinking about as we relax or ease up some of these public health mitigation restrictions that have been in place for the last 6 weeks to 8 weeks.
Yes, absolutely. Good. Thank you so much. Great start. And we do have some questions. Jim's got one to start things.
Yeah, I've got my laser point on one that I'd like to.
Okay.
I've been giving guidance to a lot of, I'm an attorney. I don't know whether you and I have met before, but I do general counsel work for various companies. I've got a serious concern with the mandate. It's not a suggestion. It's a mandate from the governor that you must designate a healthy at work officer. And my concern with that from a legal perspective is that the employer is designating someone to be properly trained and exposed to potential issues related to COVID-19. So what guidance have you gotten from the state? Because I have not yet found any that tells us who this officer is, what the scope of responsibility is, and how do we train that person? Because if I'm going to put in a factory setting, I'm going to take an HR person out of their regular job and make them the designated healthy at work officer to handle this person. Looks like they have a fever. There's all kinds of legal implications of how they go about their job, whether they're exposed to, how close they are, the PPE, all kinds of things. So when I saw that as a designated requirement, I put out an alert to the companies that I'm working for that this is not just pick Joe Smith and say he's your healthy at work officer. At some of the bigger companies, I'm actually recommending that they go ahead and hire a third-party nurse or a third-party medical care provider of some sort to bring them in to handle this, because it gets into a whole lot of potential HIPAA, potential exposure, and a lot of concern. And that, when I saw that pop up as one of the requirements, it was a huge red flag for my companies.
So that's kind of interesting. I hadn't thought about it from a legal standpoint because I'm thinking about it from more of a medical standpoint, but how would you handle it normally if we were working with you as the health department on somebody who had tested positive for tuberculosis in your workplace, for instance?
Well, but we wouldn't expect to have a designated tuberculosis officer on site to handle. But if the governor is mandating before you open, you must have an officer in charge of healthy at work initiatives, including the testing, the removal, the tracing of potential leads to anyone else, the quarantine. There's a lot of responsibility being heaped on a person that there are no directives being given. That's the fear. And from a legal standpoint, with workers' comp and customer exposure and third-party exposure tracing and so on, when a governor issues an order that says you shall do the following before you open, having an officer designation without any guidance on what that officer's responsibilities are raised, like I said, just a huge red flag.
Yeah, I guess I didn't see it that way, and but I'm not the governor, so my thought was he's just telling us these are the 13 things other than that have to be done, and somebody needs to be your point of contact to do that. And your point of contact for working with the health department, your point of contact for identifying or helping with employees who may get sick at work, and what your plan is for dealing with those. So I can't answer the legal side of it, but again, I'm trying to talk about what needs to happen from the medical side, I guess, more so. Understood.
And I wasn't trying to put you on the spot.
Yeah, I understand what you're saying.
I wondered whether you'd heard it, because that's something that a lot of, because Hanna is HR, I do HR and legal, and we're looking at this. We had a discussion last week between his team and me with regard to, you all need to be telling people, but I don't know what to tell them. So we're going to talk about that a little bit later, but that's a big issue.
Well, wouldn't you tell them these 13 points that we just talked about?
Oh, yeah. No, we've been doing that for the last 3 weeks since he started announcing his initiative. But what I'm saying is the healthy at work officer is the thing that I don't know what to tell people right now. We are definitely, if you go back and look at the slides, we've covered these workplace protection. Actually, week 1, I did a COVID-19 crisis plan where we talked about your point of contact for local, state, reporting, what you couldn't do. So we're covering it every week.
All right, great.
But the healthy at work officer is like a fire marshal designation. Before we designate somebody in the office as a fire marshal, or the red hat as we call them, they have to know what to do and where the fire escapes are and so on. So there's some training that goes into it.
All right, we're going to continue to try to focus on that so we figure out what is the best person to put in there. I think at this point it's going to be somebody that's responsible, willing to learn fast, and is a good communicator. We'll see. But that's a good start. We've got quite a few more questions. Allison or Autumn, you want to jump in and lead and share some of the questions that he's received while he's been talking?
Sure. So we did have a question about from an employer wanting to know if they could mandate employees get tested. So I know that might be a question for Jim from the legal side, but from the health department, if we even have the availability to mandate an entire workforce being tested.
So this is Kraig. I'm not sure you could mandate that people get tested for COVID-19, but the way I understand it is you can tell them that they have to be screened on a regular basis, either at work or they have to do self-monitoring and self-screening and report that their temperature and any symptoms before their shift starts every day.
There is, just to let you know as well, there is brand new guidance from EEOC on Thursday of last week. You can, in fact, require COVID-19 testing. It's brand new, but because of the pandemic designation by the CDC, the EEOC has now provided additional guidance that COVID-19 allows for an exception. And I'm going to say this caveat again every single week you hear me. This is 1, only during the CDC pandemic, and 2, subject to change at the EEOC's whim. But right now, the EEOC guidance is, yes, you can test for COVID-19. It is purely legal. I wouldn't expect the doctor to be involved in that. And if you weren't on this, you probably wouldn't hear that for 2 or 3 weeks, because that guidance literally just got published in a frequently asked question last week. And you'll see it up on the screen here in just a minute.
We've also had a question. I think we all understand that if you're in your own office, you can remove your mask. What about open spaces? If people are more than 6 feet away from each other, is it okay to remove mask at that point?
No, the guidance right now is that people should be wearing their masks if they're with others in a room, or if they're walking down a hallway, going to the bathroom, really pretty much any public space. And so I've got my mask. I'm not wearing it right now because I'm in a room by myself with my computer in front of me. But if I were out in the hallway or I was going to the break room or our operations center, I would be wearing a mask. However, people should also social distance or physical distance as well. So I like to say that these are helpful, but they are not a substitute for if you're at the break room, if you are in the hallway. Again, you don't need to be congregating. Even if you have a mask on, you should be staying at least 6 feet away from others, which causes you to have to project and talk a little bit louder, because these masks can muffle your words. And so you really have to enunciate. And I find when I go home from work at the end of the day, my voice is hoarse because I feel like I've been yelling at either phones or yelling at the staff all day. And I don't mean to do that at all, but I'm trying to project through the mask that I'm wearing. I don't know if you all have had that experience as well, those of you who are still at your workplaces. About half of our staff are, though, working from home now. So, but I still feel like we have all these teleconferences or video teleconferences, and we're all trying to be heard on these electronic devices from 6 feet away with masks on.
All right, good. Another one, Autumn. And by the way, folks, if you'll watch the chat down at the bottom of the page, we're actually responding to some of these questions in writing just to try to cover them all. But Autumn, you have another one?
Yes. So this might be more of a legal question, but they were asking how to handle situations where employees refuse to wear a mask or try to refuse to wear a mask.
We had a client last week that, I mean, I can't answer from the legal standpoint. From the health department standpoint, we had a client last week that walked in and refused to be screened by the temperature screener and refused to wear a mask. And we did not allow the client to come in to the clinic. We sent them outside.
So from a legal perspective, yes, you can discipline, you can refuse access, and that includes customers, although the governor's supposed to come out with more guidance on customer refusal. But the EEOC has come out with guidance that specifically says that because this is pursuant to a directive from the CDC, you have every right to screen your employees, to enforce social distance. We covered that a couple of weeks ago. in the presentation that the OSHA, CDC, and EEOC are all in accordance with one another, that you have the absolute right to discipline people for not enforcing social distancing, hand washing, screening. You can preclude entrance to the facility. We're going to cover a little bit of that as well.
And I've gotten the question about testing locally. In Central Kentucky, I know that I hear about Kroger doing tests and BCTC. Can you clarify those? What's going on there? How do you get the test? Can you just drive up?
Right.
And are there other places?
So there are several options for people, at least this week. And one is that Kroger is doing testing at the BCTC lot. It just happens to be that it's right across the street from the health department here at the corner of Newtown Pike and Loudon. And you are supposed to pre-register for it and get a time to come. You do not have to have any symptoms, which is interesting. So you can be asymptomatic and be tested by the Kroger folks at the BCTC lot. It will be limited. I'm not sure if it will continue next week. It's been going on this is the third week that it's been happening in Lexington, and they're doing over 1,000 tests a week at that site. Another site is on Executive Drive. The Walgreens is testing. They have specific criteria to be tested there, though. It's fairly liberal, so if you're either symptomatic or you're a contact to a case or you're a critical part of critical infrastructure like a first responder, you can get tested there. You could meet their criteria, and they're probably doing about 50 tests a day, and they have the capability of actually doing what they call point of care tests, so they know the results usually that same day. You can find out your results. There are many places around town that are also doing testing. The health department early on partnered with several different providers here in town to provide test kits and a way for them to be able to send those test kits into the lab and get results. So if people are having trouble finding places to get tested, I would have them call our information line, again, 899-2222, because there are options available for people to get tested.
Cool, great. Autumn?
What about common areas like refrigerators? A lot of employees like to bring their lunches and it saves money. How should we handle those scenarios?
I think that's a great question. So that can continue. Of course, hopefully people are labeling their lunches in the fridge. I do think that you have to space people out in your break rooms. Ideally, people would eat outside, actually, because that is going to provide less risk for folks. But if they are eating in a break room situation, since you have to remove your mask, you want to have people far apart from each other. You do want to be paying attention to the refrigerator door handle and cleaning it on a regular basis because that is a high touch area.
Okay. What about if an employee spouse, so I have a question about an employee spouse has a temperature, employee doesn't have any symptoms, should we quarantine them for 14 days? We don't know if the spouse has it or not.
You can speak with us about the guidance about that, but in general, we would not quarantine somebody who's a household contact of somebody who's not a known case. We would probably encourage the spouse who's symptomatic or the household contact who's symptomatic to be tested so we can know the result. And obviously, if they're positive, then we would ask all household contacts to quarantine from 14 days of the last exposure. What gets a little hard here is that if they're living with someone who has COVID-19, their last day of exposure is really the first day that the person who has COVID-19 that lives in the household is released from isolation. So in other words, they're continuing to expose the household contact, the case is, up until the time that they're no longer infectious. And again, we can help you with that. It's something that we do every day. We follow all of our cases of COVID-19, And then we advise about household contacts for how long they need to stay quarantined, looking for signs and symptoms in themselves.
And it sounds like we're going to need to learn to do that in the workplace. We have.
Well, I think you don't need to learn to do it there so much as to learn to understand what we do and how we do that. But when people have COVID-19, they test positive, we give them an isolation order. And then for their household contacts, we give them a quarantine order. But they basically both say, we want you to stay home for defined periods of time until we determine that you're able to go back to work or back to be released from isolation, essentially.
Wow. So we can count on you all to help us do that, is what you're
Right.
saying.
Yeah.
And do you have enough people to do that, or is that going to be
Well,
okay?
that's the idea, is to continue to, and right now we've repurposed or reassigned a lot of folks, and that's their daily job. We also have an electronic system that helps us do that and helps to monitor the active cases every day. So a lot of it's now done electronically. We send them the isolation and quarantine orders electronically. They can also respond to us electronically daily with their symptoms and with their fevers. So that's we're still working on that process, but we can do a lot of it virtually, and it also helps the patients as well, because they can do it a lot of it through their iPhones anymore.
Great. Boy, somebody wrote in on our chat below that they have a friend that just drove up at the BCTC and got right in. And I've heard you can do that. That's a good thing. We also, Chase Adams on our team published the number out there if people are looking for the phone number at Kroger to make an appointment, just to probably speed up the process a little bit. So that phone number is out there on our chat below. Good answers, good questions, good answers. Autumn, anything else?
Yeah, one more. How should we handle an employee that refuses or says they can't wear a mask due to asthma or some sort of breathing condition?
Yeah, we've had that question, and again, our response has been, if you want to come to the workplace and work here, that you need to have it. But I referred them to our HR folks if we needed to talk to them more specifically about the reason why they couldn't wear a mask, and perhaps they can telework and not be in the building, because the directive from the governor has been, if you're in the building and you are interacting with other people, then you need to be wearing a mask. So I think that has to be worked out individually in each workplace.
All right. Hey, Dr. Humbaugh, thank you very much for joining us. I know you're busy as can be. It seems like you're really keeping ahead of things, and we appreciate it.
Yeah, it's great to be here. Thanks again. Good luck with the rest of your meeting.
Thank you so much.
Thank
Take
you.
care. Have a good day.
You too.
And we're going to jump on to Jim. Jim has got a whole host of questions to answer for us. So everybody knows Jim pretty well, but he's becoming more and more popular. Jim Morris, an attorney in Lexington, and has really gotten a head start on this stuff 9 or 10 weeks ago and been with us for 8. And Jim, I know we've been funneling questions to you all week. So if there's somebody out there who sent us things that we haven't replied, if we've got a quick answer, we do it. If there's things that are going to take more detail, we've been sharing them with Jim and working on them together. So why don't you jump in, Jim, and take it away, and keep the other questions flowing our way if you want to, if you have other thoughts. Go ahead.
So let me cover a few things that were asked toward the end. I just want to make sure you all know where it's coming from. So first, on your screen, you're going to see frequently asked question A6, which is new from the EEOC. You can administer a COVID-19 test because of the protection of your other employees. So you can force that on your employees. You cannot, if you want to pay for the test at your cost, you have that opportunity. It is an allowance now under the policy. The other one is in the EEOC with regard to return to work. Sorry, it's a little glitchy here. Steps that you can take to screen employees. It allows for the temperature check, direct threat with regard to employees and what you can do and so on. So there's a lot of guidance on there. Take a look at your EEOC background on that. The PPE is based upon specific guidance from your governor as well. And this is the part that was covered at the end. It's a pure legal question. That's why I said in the chat that I was going to cover it later. You'll see a little bit later where I go into detail, but you are required to provide modified personal protective equipment for anyone with asthma or anything else. You have to grant those if there is not a substantial cost, and there's brand new guidance from the EEOC. They screwed up early in the week last week. They made some comments about what you should do to protect elderly and people who are immunocompromised. And then they came out later in the week and said, yeah, I'm sorry, we screwed up. Don't listen to our earlier guidance because somebody said something they shouldn't have. It basically allowed employers to discriminate against older people. So they came out later in the week. This is G3, G4, G5. And G5, they actually corrected later in the week with regard to the direct threat. They came out and said they're sorry about all of their confusion. That's not my first slide, but I wanted to cover that because it does impact everything you all were asking. There's a whole lot of legal going on, that you need to be aware of. This slide for later, sorry. Move that off the screen, go back to where we were. So, I have gotten a tremendous number of questions about 787 KAR 1:350E as an emergency. This question, or this is a regulation that is on the books. I'm trying to find it to pull it down on the screen so that you know that I am getting it from our government. So bear with me for just 1 second.
All right. So this has, while he's looking, this has to do with Kentucky Workshare regulations. That means you have people work part-time, not full-time. Can they receive some compensation? The answer is yes, but the system is not communicating that properly right now. So Jim's going to try to highlight that for us.
Correct. And I want to put this on the screen so everybody can see it. And I'm going to copy it right now and put it in the chat so that you can actually go there yourself later so that you can see this, because this is, believe it or not, the only place you can find this in the public record. It is, if you click on, you scroll down to, sorry, not elections, right here, unemployment insurance, and click here, you will then get to the Workshare instructions. It is called the short time compensation. I covered this last week a little bit, but I want to let you know the system is still ridiculously broken. I know the governor got on and said there are 100,000 calls answered. What he didn't say, and this is not a political statement, this is reality, those are robocalls back. I think I told you all I have a call pending to the unemployment office from April 3rd. I still have not been called back, other than every 3 days I get a robocall at 7:30 at night that tells me my call is important and they will get to me as soon as they can. I am in the queue on 3 different phone numbers. All 3 have not gotten a call back. So it is just broken. And I don't know what they're doing. I don't know why they're not fixing it. It shouldn't take this long. I was told that those regulations were going to be put on the website no later than last Monday when I gave them to you. They're not on the website. So a couple of things. One, I'm going to talk about something here that you all as employers or HR really need to think about, which is you should start to become creative during this assistance from the federal and the state to avoid laying off or furloughing your employees. What do I mean by that? There are opportunities out there because the federal government is willing to give $600 per week to anyone that uses a Workshare if the state has adopted a Workshare program. Kentucky has now adopted, pursuant to the regulation, a Workshare. Whether or not they're putting the application out there, really shouldn't matter because they have adopted it, and the executive director was under an order from the governor to issue an application for you all to utilize. If you utilize that correctly, instead of laying off one person, two people, six people, or 10%, 20%, 30%, if you think about it and you take your employees and you work share them where they are 10% off of their regular work, everyone will get an additional, they'll get 10% of their unemployment benefits. That's not much, but they'll also get $600 from the federal government.
A week.
So, a week. Sorry.
Yeah,
I thought
week.
you were asking a question.
No.
Per week, they will receive $600 from the federal government and 1/10 of their state unemployment benefits. If you do 20%, they will get 20% of the state plus $600 from the federal government. You have an opportunity right now to take full advantage of that. I would highly recommend you do so, but I would highly recommend you do so quickly because if you recall a couple of weeks ago, I pointed out that Kentucky only got $1,300,000 in the Workshare program, and that's assuming that it gets approved. If it doesn't get approved, then the employer has to pony up 1/2 of whatever that is on the state's unemployment. So if you pick 20%, you lay off everybody 1 day a week, they work 4 days a week, you have to pay 1/2 of that 1 day, but then they get the extra $600 from the federal government and you're only paying 1/2. You need to think about that. Between 10 and 60%, you can lay people off and get that benefit from the state and the federal. It's never been available to the state of Kentucky. It is now under this particular regulation on the website that I gave you. So, I've been asked this because I had it in an email from them to one of the companies I work for as general counsel. They said point blank, if you make more than $552 per week, you are not eligible for Workshare. If you are salaried, you're not eligible for Workshare. Both of those are outright false. We covered that last week. The attorney for one of the attorneys for the Kentucky Unemployment Insurance Commission notified me personally that this is inaccurate, that they have apologized because different companies are getting different guidance. I've seen everything from local chambers having this information as a frequently asked question to my own clients who contacted me and said, basically, what the heck just happened? You told us this, and now they're telling us something completely different. They corrected it. If you go to the regulations, and I'm going to pull them down on the screen now, we're going to cover this. It's going to take a minute. It's going to be a little glitchy, but it didn't work very well in the whole process of the slideshow. So, going up to the top, I tried to highlight this, but believe it or not, the official version, if you click where I told you to click, it's actually crooked just like this, so it's almost impossible to highlight. So, this is the regulation. It expands partial unemployment compensation by implementing a short-time compensation program. That's in the introductory on the first page. If you go down, it identifies if it's between 10% and 60% with no reduction in the hourly rate or the equivalent thereto, which means salaried, exempt, so on. Goes on the next page. An affected unit is 2 or more workers. Question I have right now that they can't answer because I can't get anybody to call me back for 6 weeks is if one of them has employees throughout the United States, but only one in the state of Kentucky. So what does that mean? Everyone is telecommuting and everyone works from home throughout the United States. So what do? Do we have to qualify in each and every state, or do they qualify as a whole? No answer. But if you move on down, participating employee means an employee who works a reduced number of hours under an approved short-time compensation plan. There is no definition of limited amount of hours. Limited amount of salary or per hour. Nothing like that. So all of the information that you've gotten about 552 maximum benefit is inaccurate. The emails you received from Workforce at KUIC or whatever it is, that Workforce email was being answered by several people, and they got no guidance at the time that they were giving that information out. The problem that you've got is this. You have to have a short-time compensation plan. The short-time compensation plan has to be done by a short-time compensation application. That application has to be done through the executive director right here, and the executive director has to issue some type of application on the website. It has to be approved within 15 days. There is no application on the website. There's no information about this on the website. And one of the frequently asked questions I've gotten basically every day this week, where is this handbook you said was coming out? And my answer, you're going to see it here in a minute, a little bit sarcastic, is I have no clue because I don't know what they're doing. The plan, this is the problem you've got, and the reason why I gave you the link, you're going to have to go there to look at it. The application must have 23 different answers. Starting at this area here, shall develop an application, employer wishing to participate, A, B, C, D, all the way through U in the alphabet. I'm not going to go through all of them. You probably need to get some guidance from someone because answering these, some of these get into some legal issues and so on. The Roman numerals and everything are wrong on here. There are typos in here. Obviously was rushed out. I'm thrilled they rushed it out, but then they haven't implemented it, and it's been a full 10 days right now since it was adopted and file stamped on May 1st. So you're going to need to go through and look at these. My recommendation right now, right here, handbook's still not available. I would submit an STC plan to the executive director. I would email that, and I have done that now for 2, where I have submitted 2 different applications for 2 different clients, emailed directly to everybody I can find an email for so that it's on record. It may well be rejected, but at least you've put it in place and you can challenge it if and when they reject it, but they don't have an application. I looked literally as the doctor was talking to you on their website, click here, and when you go to it, it's great and wonderful information. They are still hiring. It's the same Twitter at the bottom. Down here, it's great. They still tell us, where is it? I don't see it. They're hiring, but they still don't have any information on there. This is still the old COVID-19 from, and that one's up on my screen too, April 13th. I'll drag that down here in a second. Filing mass claims hasn't been updated. Oh, the tweets, here's the tweet, but it's not showing up. They're hiring as of, I think that was in March. That's their last Twitter update. Very disappointed with our administration in terms of, not the administration, the executive director and so on of the Kentucky Unemployment, because you all are starving for information. I promised it to you last week because I was told it was being published no later than Monday. Still not out there, but those are file stamped Kentucky administrative regulations. They took effect on the day they were file stamped. Until they're pulled down, that is what you have to live by. I would highly recommend you take a look at it. So that is the update on Workshare. I apologize that there's nothing more to give, but they're just not doing their job right now. All right, EEOC update. We've now covered a little bit of this, but I want to walk through it with you because it's critical. So last week, the EEOC came out with 2 different updates because they screwed up on the first one. I've already told you about that. High-risk employees have the ability to ask for reasonable accommodations. I'm a little shocked they haven't fixed one thing, which is my guidance to employers is if you have a reasonable belief that someone has a disability, you do have an obligation to be, and this is in the ADA guidance, so this is not my own suggestion, you have an obligation to work with that employee to ask them to reach out to them both on FMLA and on ADA. You cannot sit back with your head in the sand and act as though you have no clue. Their statement is if the employee doesn't ask, you don't have to do anything on COVID-19. I find that a little risky. I think you're in trouble if it's open and obvious that somebody has already openly said, you know, I have asthma, I have diabetes, it's openly known to everybody in the office, or they are immunocompromised in some other way. I think you are at risk if you don't take action, but their recent guidance is the employee must ask. You use that as you want. I think it's going to change in the next week. You cannot exclude, and this has been asked of me all week long, hey, somebody's 65 years old and I just don't think they should be coming into the office because I think they're going to get sick and I'm afraid and I don't want her to get sick. What do I do? You cannot say you can't come into the office because you're 65 years old. Last week we talked about it, the Walmart greeter. You cannot have the Walmart greeter who's 68, 70 years old, retired, and standing there wanting to work, and you tell them, look, I love you to death, but I'm not going to let you do this because I'm not going to expose you. You can't make that call. Now, you can sit them down and tell them, older people are at risk, immunocompromised are at risk, heart conditions are at risk, diabetes, obese. You can talk to your employees openly. In fact, CDC highly recommends you do that. But you cannot bar someone from doing their job if they are at high risk, if they want to do it, with one exception, and it's below. And if you're going to do this right here, this direct threat that they just came out with, I'm not going to promote myself and I'm not going to promote the legal profession because there's a lot of problems in our profession, but I'm going to tell you right now, if you have any inkling that you intend to utilize the direct threat caveat to the EEOC, where they've said that you may be able to use direct threat, you darn well better use your money wisely and hire an attorney to give you guidance, because you are walking down an extraordinarily dangerous, extraordinarily narrow path that the EEOC basically has set out traps for employers. Yeah, if you see a direct threat, you could do it, but if you do it, can't just be that they have a disability that poses a direct threat. It must be a significant risk of substantial harm to his or her own health, not anyone else's. You must do an analysis, document the analysis in writing of the severity of the COVID outbreak in your area, the employee's own health, the employer's workplace, and here is the gotcha. They want every single measure you've taken, and that there's no other measures you could take that would protect this employee. If you can do anything to protect the employee and you haven't done it, and then you don't bring that employee back, you're going to be subject to a discrimination claim because you took action against somebody clearly because of their disability or their advanced age, which is by definition discriminatory. So I beg you, if you're going to use the direct threat, make darn sure you have legal staff ready to go that has looked at this individual, has all of the documentation. I won't even say that this is an HR. You need somebody who specializes as an attorney in employment law that understands the EEOC, because they will come after somebody who utilized this to pick on a person. That's not what I'm saying. What they will say to pick on somebody who is above the age of 65 years old or has immunocompromised system. Be extraordinarily careful. That guidance came out, it's been corrected, and then that guidance is still bizarre. So I put it on here because it's out there and somebody's going to go, oh, well, I don't have to bring anybody back because they are definitely a direct threat to their own significant risk of substantial harm. And no, because then they go on to say all of these other things, including this one right here, your workplace, and that you have not been able to adequately protect them. If you admit that, you're going to have other employees saying, well, I wasn't protected either. So you don't want to be Walmart in Chicago where you get sued because you didn't protect the health, safety, and welfare of all of your employees. So be very careful. All right, so it says that the employee must notify the employer of the need for the accommodation. I put that out there because it's actually in their recent guidance. I disagree that that is a full-blown, because if you use the head in the sand approach, it's typically not a very good defense in front of a jury, and the EEOC loves to investigate people like that you knew but you looked the other way, so just be careful. PPE. Under this accommodation, the question was asked earlier, PPE, if it doesn't cost you a fortune, the answer is yes, you must have reasonable accommodations for people with asthma, people with breathing conditions, people that can't use a regular mask. It is the employer's obligation to come up with a reasonable alternative. That is in this section right here. And I want to cover this very carefully as well for the direct threat, because you still cannot, so people are like checkbox, yep, direct threat, yep, significant risk of harm, yep, we have an outbreak, yes, it's their own health, yes, I've taken all the measures I can, I still can't protect them. The EEOC says, wait, not quite yet. You have to make sure that there are no other reasonable accommodations you can do whatsoever for your employees. These are your asthma, these are, like we said, the advanced age, so on and so forth. That you can't telework, that you can't just give them FFCRA leave, that you can't reassign them, that you can't give them protective equipment of any type or nature, that you can't build them a separation barrier, that you can't eliminate or substitute some of their non-essential functions, and that you can't temporarily do a schedule modification. So if you look at all of those factors, starting from here to here, I won't say don't do it, but please don't do it without legal guidance, because you are just begging for the EEOC to do an investigation of your organization for discrimination, whether you were well-intentioned or not. They don't care whether you're well-intentioned. If you've had an EEOC investigation, they don't even get into the investigation. It's the employee that files it. You may have been trying to do your job to protect them, and they don't care because they see easy money. Be careful. All right. Next part down here is, because I've told you sometimes the guidance from different organizations doesn't mesh. Here's your doesn't mesh update of the week. EEOC says you can't take any action, can't protect vulnerable, you've got to do all this, direct harm and significant risk and all these different things. What does the CDC say? Vulnerable workers, defined to include individuals over the age of 65 and those with underlying health conditions. It suggests that the employers provide duties that minimize their contact with customers and other employees if agreed to by the worker. So, doesn't really not mesh, but it is a little different because it seems to be suggesting that you kind of push them into something. My recommendation is, if you're going to have an employee agree to a different job function as an older employee or immunocompromised, one, get it in writing. Two, make darn sure that the writing says that it's not a threat, that they have voluntarily agreed to do this, that you've talked to them about the exposure, and that this is not being done for any discriminatory, retaliatory, or otherwise to do anything against this employee. It is to protect them, and so on and so forth. I highly recommend that document be somewhat legalized. And by that, I mean HR or an attorney writing it to make sure that they protect your backside, because you will be challenged. No matter how well-intentioned you are, be careful. All right. PPP ongoing confusion. I talked about this last week a little bit, but I think that I may not have been very clear. I'm hoping the SBA makes changes. You'll notice here there's still no clarification from our Treasury or the SBA as of this morning. I tried to see if they would put anything up, because Mondays they love to throw a bunch of stuff at us. Right now, the guidance from the SBA and the Treasury is that 75% of the loan must be paid toward payroll. compared to the, quote, last full quarter in which the employee worked. Last full quarter is 13 weeks long. 75% of 13 weeks is 9.7 weeks. You can't pay 9.7 weeks in an 8-week period. So there's no clarification on that. I suspect we will get some clarification, but for those that currently have your PPP, all I can tell you is the same guidance I gave last week. Please contact your bank. Unfortunately, most of the banks are responding with, yes, we're aware of this. Yes, we will be issuing you something, but we have no clarification as of yet because we have no clue what we're supposed to do because the SBA hasn't given us any guidance beyond 75% must go toward payroll. So all I can tell you there is, I'm sorry, I can't give you guidance. It doesn't exist. Contact your bank, get it in writing. If they don't have any guidance for you right now, it's kind of hard for you to follow the guidance within the 8 weeks during your PPP. Still massive confusion on the PPP. What we do know, your certification of the loan must identify your current activity, the fact that this is needed regarding your current activity, that your access to other sources of liquidity is being impacted, and whether these options would be significantly detrimental to your business. That is new guidance. If you got your loan prior to August 23rd, this may or may not apply to you. Why do I say that? Because question 17 specifically says any new guidance does not apply. You are stuck with the guidance that existed at the time of your application and prior to signing the final loan documentation. So what you need to do as a borrower under the PPP, I'm not going to waste a lot of time on PPP because it's almost done. They've run through another, I think, 180 billion as of yesterday, so they're halfway through the last half. But just so you know where they are, that was as of May the 8th. I've got all the breakdowns by state, but I'm not going to drag it down. You can look at the SBA website. They've got a new report about all the monies that they've gotten, where they've gone, so on and so forth. What you need to do is document what you did, when you did it, why you did it, and how you did it, so that you have verification of when you received the money. At the time that you signed that final certification, this was the lay of the land. It's very easy to show the impact because the entire world has been shut down. Everything from nonprofits through your banks have been impacted. If you can demonstrate that you were impacted by the actions that were taken and you document the steps taken to investigate, you're going to be okay. Subject to review, it's mandatory for anyone over $2 million. It's discretionary less than $2 million. Basically, guys, if you didn't need the money, don't take the money. If you took the money, make darn sure you needed it and document how you did it. That's the gist of it, because you're dealing with the federal government. You don't want them investigating you needlessly, so just make sure you used it for right purposes, that you needed it at the time you asked for it. Amnesty has been extended. It was May the 7th. They have extended it through May the 14th for additional guidance. Problem is there's no additional guidance out there. I do have frequently asked questions from the Treasury Department, so that you can see that. Here's your Treasury Department frequently asked questions. The last one was May the 6th. Trying to get to the bottom so you can see it. This is the bottom part of it. I don't know why there we go. For some reason, my mouse doesn't work on the screen. 45 questions. You'll notice that tells you the date when they're published. May the 6th was the last one. May the 6th says we're going to extend the deadline through May the 14th so that we can do more guidance. There is no guidance because that's the last question. So stand by. Sometime before May the 14th, they'll be extending it to May the 21st. Why? Because they haven't given you the guidance they promised. So that's the only guidance I have, is there is no additional guidance for anybody who's concerned about the amnesty program. The gist of the amnesty program is, you heard the names. They had Steak and Shake, they had Ruth's Chris, they had the Hilton Marriott, and some of the big boys that had a lot of franchise locations, a lot of separate locations, because the original plan was for each location to be able to apply for it. Quite frankly, I'm going to be blunt here. I'm not sure that any of those organizations had to return the money because basically up until everybody got caught, everyone, including the Secretary of the Treasury, was declaring that any business that qualifies at all should take the money. So everybody was being given an instruction, get your money. So it's kind of silly to threaten them now after the fact, but it's there. Guidance is changing every day. Again, I can emphasize this every week. This doesn't just go for SBA, this goes across the board. Document the date when decisions are made, the then current guidance and the rationale for the business decisions related to whatever you're doing, including the SBA. EIDL, heard me talk about that in week 4, I believe, week 3 or 4. Emergency injury disaster loan and emergency injury disaster grants. Unfortunately and fortunately, because we have a lot of people on this call that are in the ag business is extraordinarily widely described. However, EIDL grants are now, for whatever reason, and they haven't said why, limited solely to agricultural businesses. So the second phase is only for ag businesses. Phase 3.5 says, right down here, applicants who already submitted their applications will continue to be processed on a first-come, first-served basis. So if you followed my guidance earlier and you submitted one, they will still consider it. However, if you did not, only agricultural will now be granted. And it's kind of weird because the way they did it on their website, up here, it just talks about new eligibility. It goes down through the different areas, all the great and wonderful things. It's resumed processing, all this stuff. And then right down here, for whatever reason, they just put in italicized, only agricultural business applications will be accepted due to limitations in funding availability and the unexpected submission of applications already received. No explanation on the SBA website, no additional guidance. It's an undated document, but I believe it was issued on Friday of last week. I didn't see it until then. It's really kind of bizarre, but if you're in the agricultural business at all, which is defined as businesses engaged in the production of food and fiber, ranching, raising of livestock, aquaculture, and all other farming and agricultural related industries, which is an undefined term, all other farming and agricultural related industries. In Kentucky, that's a far-reaching, you may be involved through a customer, a client, selling to, buying from. It doesn't indicate how far that goes. Then it says down here, it's encouraging eligible agricultural businesses with 500 or fewer wishing to apply to begin preparing their business financial information. You shouldn't be beginning, you should be submitting. So I don't know what that's about, but that's the new guidance. I just want you to be aware. Practical advice, here's some questions and answers. Some of these I've already covered above. These had not been covered before, but some of the questions came out, so we've already thrown them out there. Is it sufficient to have each employee self-verify and call in if the temperature is 104 or above? This is where legal's a little different from health because the doctor's correct. You could have people recording it themselves at home and reporting their health. There are some real substantial issues with doing that because if you don't have a properly trained individual identifying 104% or above, 104 degrees, 100.4 degrees or above, you're liable, not the employee. The other thing, I threw this into the chat. I have a international customer right now I'm dealing with because they're working through the European Union, England, and United States. I'm giving them United States guidance. And guidance is different everywhere. So they're like, well, wait, what's a temperature? 99 is a temperature. No, it's not. Temperature under CDC guidance is 100.4 or above. Anything below that, you need to be having an HR legal policy and procedure in place as to how you're handling that. That's why we're highly recommending you track temperatures. One of the things I threw in there about the work from home or the testing at home, one, You heard the governor last week declare that you must have policies in place, and he was going to publish some kind of written guidance for testing from home. It better not just be that they have the same temperature every day. All right, that's good, but no additional guidance is out there. Here's a little caveat. Welcome to the legal world. How much are you paying your employees to test while they're at home? If you're talking about an hourly employee and you're telling them you want them to test every morning, you have to pay them to test because that's your direction. They're under your suffrage at the time that they're doing their own testing. So be prepared because the OSHA wage and hour, there's a lot of gotchas in this because if you're asking people to do anything, they are working for you at the time that you're doing it, which means you have to have a policy in place. You take 5 minutes, you test, we pay you. You go away, we're not paying you anymore. You can't walk around while you're testing. Please don't go up and down the stairs while you're testing. Please don't be in the bathtub with an electrical thing plugged into the wall if that's how we're testing you. You have to supply it to them because if they have to go out and buy it themselves, then you have forced them to buy PPE for themselves. Yeah, are they calibrated? Are they accurate? How are you verifying accuracy? There's all kinds of issues for testing at home. There is a company that is doing a 14-day test at home. Then they'll have a little badge on their phone that they can use. I have a big problem with that. I recommended the international company not utilize that for this reason. One, what verification do you have that anybody is doing anything accurately at home? Two, that badge declares that you believe that person is COVID-19 free, but yet we have no proof that they are. There are substantial issues with that. I highly recommend you test on the day. Well, you have to test on the day they come in anyway. So doing it at home suggests that you've taken on that added responsibility, but yet you don't have any verification of the proper steps taken. And that company that's doing the 14-day testing is actually relying upon self-reporting from the employee to get a badge. There's nothing that that company is doing to verify the 14 days straight, but you're paying them a tremendous amount of money for that quote-unquote badge. So I'm very concerned about the liability, the workers' comp, the FLSA for paying them and so on, so be very careful. Question is, the second one, unemployment insurance offices provided wildly inconsistent guidance about reducing hours, what benefits will be received, what should we do? Said this earlier, prepare an application in letter form, send it to the executive director. Do not wait for the application because there's going to be a deluge of applications all at once. He has 15 days to review those, and it's going to take forever to get through them all. Is there a maximum amount? At this very moment, under the KAR, the answer is no. The guidance says anything above $552 a week, that person cannot participate. That is false. Again, I can't emphasize that enough. On Monday's call, it was mentioned there'd be a new handbook. I've already told you, and that's why I said, have I mentioned that the Kentucky Unemployment Insurance Commission is broken? I don't know where that money went for all of the call center people, but all that you're getting is an automated message. Good luck trying to get through. So that's the guidance for the week. I haven't been able to pay attention to question and answers, so hit me up if you want to do these. If we run out of time, we'll do them next time or this week, or people can call me.
I don't think we'll have time to get through all of them, so I'll just go ahead and hit a few high points.
Sure.
We've had a number of our clients and some questions come in about how to handle, we're seeing employees post pictures on Facebook or social media of not social distancing, but saying that they need to social distance for work and how to handle that.
So this is running into some CDC, EEOC guidance that is conflicting and contradictory. Under the CDC, they say that you have the opportunity, if you reasonably believe that there are some problems with employees, to require them to quarantine for 14 days. EEOC basically says you can't scrutinize people's off-work hours. You cannot engage in policing people. You heard earlier the governor made an instruction. I think it was a little bit of a slap, and I think it probably was not well taken given the testing now that shows that Tennessee's doing quite well per capita, not the total number, but deaths per capita versus testing. But he said nobody can go to Tennessee, closed the border. He got sued. You can't stop people from going across the border. He wanted to put in place some kind of restriction that if you go across the border, when you come back, you have to quarantine. He got sued. You can't do that. I'd be very careful about scrutinizing people's off-work behavior. If any of those people that they're with have COVID-19, sure. At that point, you have the ability. This also gets to somebody with a temperature in the household of 102. What do we do? Reported to the CDC, followed their instruction and guidance. It was what I was going to say before the doctor weighed in, and Dr. Humbaugh did a great job of saying, report it to us and we'll tell you what to do. But just social pictures. One, I'm going to throw out another legal fun wrinkle here. There are serious implications for an employer scrutinizing an employee's Facebook page. It is now called the water cooler in the National Labor Relations Board. That is the modern water cooler, where employees can complain, talk about their employer, post whatever they want. We actually have policies in place for management with regard to what is and is not allowed in accepting an employee's request, or especially sending one out, to be able to be a Facebook friend of an employee, because you are subject to NLRB guidance on that, and you cannot be monitoring an employee's social media. So I would be very careful using an employee's social media to scrutinize an employee's off-work behavior. Sorry to be the bearer of bad news, but you can pull that up, Facebook and water cooler, and read what the NLRB has said about it, and it's kind of scary. So just be careful, especially those that are big enough for unions, because that's what I spend a lot of time working with, is what you can and cannot do as management with unions or potential unions, union efforts, and so on. So
I'll have a couple more.
Yep. What about using or issuing bonuses to hit the 75% for the PPP loan?
So see, that's the problem, is that the PPP application specifically says you won't be using it for bonuses, that you'll only be using it to pay the payroll that was equivalent to what you presented to them during the application process. So the problem with giving bonuses that were not part of the application, now that's why I qualify it. If during last 2019 you gave out bonuses and that got kind of absorbed into this amount that you are allowed to get because you gave a Christmas bonus, making that up. And so when you ran your calculations and you did the 2.5 times the monthly average, and you came out with this magical $120,000, if bonuses were part of that, great. But you can't give bonuses now to try to meet up with the requirement, because the rule says you cannot basically pad people's pay on the government's dime to try to pay them more than what they were entitled to. You have to use the first quarter, then you have to pay the 75% of that must be payroll based upon the last fully completed quarter in which the employee worked, which for 99% of you will be the first quarter of 2020, which is the 13-week quarter. And that, somewhere in there, somebody's going to finally realize there's a massive calculation problem. The problem is that everybody will have expended their PPP proceeds based upon the then current SBA guidelines, and the money's gone, and then they'll say, whoops, no, that's not how we meant to calculate it, but you can't pull back the money if you paid people to stay at home. I think you're going to see guidance as well, and I hate to tell you this if you've gotten your PPP, that's going to say, wait a minute, you didn't have to pay people to stay at home. You're already paying them to stay at home. We meant as soon as you opened your business, that's when the 8 weeks started. But that's not what the law says. It says it starts the day you get your application. So they're going to come out with a whole lot of things that try to fix it after the fact, and it's going to be a disaster because you can't fix it after you've spent your money. Again, I'm sorry, but that's the then current guidance.
Another question, wondering if you could elaborate on the $1+ million the state was granted for short-term compensation relative to the payback of employers. 1 million seems so small. Can companies even
Yeah, so basically what that was is that the government, the CARES Act set aside a certain amount, and then they were supposed to run calculations based upon other figures to divide into the 25 billion, and don't quote me on the amount. But when you ran it out, Kentucky's share of the Workshare percentage was $1.3 million, and I think Lyle commented on it last week. I don't have the slide available, but I do have one I want to share that I forgot. It has nothing to do with the question, but it is critical. I want everybody to see this. This is the governor's COVID-19. This is Kentucky's Healthy at Work initiative. You heard a little bit of this from the doctor, but I need you to be careful if you're in these industries to click on these, because there are specific, this is again, the Team Kentucky COVID-19. This is where you go to get your information, Healthy at Work, benchmark for reporting a reopening economy. This is what I need you to look at. First, because he got sued because the federal government said, or the federal judge said that this was illegal, he flipped, and places of worship were very quietly, but on Saturday, open. Then on the 11th are all of these: construction, horse racing, manufacturing, distribution, office-based, pet grooming, photography, vehicle and vessel dealers. And then they also next week have government offices and funeral homes. Each one of these has their own mandate of what you're required to do under Kentucky. You must comply with all of these specific requirements for your industry in the state of Kentucky. This is in addition to OSHA's that I showed you last week, where they had their specific instruction and guidelines for each industry. So please make sure you go to the covid19.gov/KY, I think is what it is, to get your specific guidance. It's right here. Then get to the Healthy at Work initiative, click on that and figure out for yours, because you don't want to be on the wrong side from your employee suing you, your customer suing you, or some type of action taken by the police or health departments based upon Governor Beshear's directives. I apologize for interrupting you, Autumn, but I saw that, and that's brand new guidance for each industry that was posted, and I want to make sure you are aware of it.
Good stuff. Autumn, one more.
One more?
We're running over already, so, but there are a lot of questions out here. We'll try to get to these after the call.
I do want to say the performance reviews and normal raises, it's going to be up to each, and I'll say this for bonuses. One, it's going to be up to you as the employer to prove your PPP entitlement. Two, it will be up to your bank to determine the extent to which you're going to be entitled to relief from your loan. So if you believe that you can convince your bank of the need for the quarterly raises, normal things that go on, that's between you and your bank. But the question was, how can I make up the difference to get to 9.75 weeks? Can I just give a bonus? And the answer is, in the PPP, it excludes bonuses. Now, if these were regularly incurring, that's going to be a legal question, an accounting question, and a banking question. I would get legal guidance, tax advice, and argue with your bank about it and see what answer you get. Go ahead, Autumn. Sorry.
One question about paying back the EIDL if you also receive the PPP. Will that lower your forgivable amount of the PPP?
No, but it becomes part of, well, lower your EIDG. If you got a grant, the grant is part of the monies that you received from the free money that you get during the first 8 weeks. You cannot double dip. I think we covered that in week 3. If you get money from both sources, you get to use that money. And I gave some hints on the EIDG, EIDL to try to flip that into a loan so that you can use that, because the EIDL has a little bit broader scope on what you can use it for at 1% interest. My guidance is basically spend it on your payroll if you need to, and then keep the additional money at 1% and spend it on the allowable things that you can use it on, which are a little bit bigger than just payroll. But the worst case scenario for you is you get the 8 weeks and then you have to pay back at 1% interest. It's not a bad deal. But no, you cannot get both. I'm sorry, you cannot get both and claim both for free. You can only get one or the other, and obviously there's more money in the PPP. Now, I don't want to scare everybody on the PPP. Worst case scenario, you have to pay part of that back. You're going to get a pro rata share that's forgiven, but it's just bizarre that they've come up with a calculation nobody can meet right now. That's all. Quick answer to a question about employee quarantine. I don't believe you can force a quarantine unpaid for people who take a vacation out of state right now. It's kind of what the governor got sued on when he said you can't leave the state, and if you leave the state, you're mandatory quarantine when you come back. You don't want to get sued on something the federal judge has already thrown out the state's governor's attempt to do that. He did come back with a lesser recommendation. Just be careful as an employer, because you're governing off-duty conduct, and that's risky.
That's a good one to end on, so they can still take vacation.
Oh, well, I'm not saying that.
No. But we can't control it as well.
Yeah.
Thank you very much. We're going to keep taking questions if people want to write us emails or text. Just know that we appreciate your feedback to us, because during the week, Jim and our team, we're working on these things. In fact, during this call, I've already written to one of the key members of the governor's team about the unemployment. Jim, he said he'd talk to us as soon as this is over. During the week, we're trying to, resolve these issues, these challenges, and your input really makes it easier to do it. When we can say we've got employers that are confused by this, isn't working, they're not getting feedback, that kind of stuff. So let us know. We're working on your behalf, and thank you so much for hanging with us. You all have a great week, and we'll talk again next week. Any final words?
The only thing I want to do was, I'm giving my email address in the chat. Please don't just ask for legal advice. I can't give you one-off legal advice, but if you have examples of what has happened to your business, please send me examples that I can work with the unemployment office on. I'm not giving them employee-specific information, but if I can tell them, look, I've gotten this from various HR perspectives, I will definitely push it on them and show them the different examples, and I'll still not even give them your name if you don't want me to. That's it.
All right. Thank you very much. God bless everyone. Let's have a great week, and we'll talk again.
Thank you all.